Welcome Berlin, welcome Stockholm, welcome Barcelona. My name is Juergen Osterbrink, and I'm presenting as last obstacle before you are going to your leisure time an aspect about digitization, and I would like our technician to start my presentation, please. Thank you so much. It's about the development and deployment of digital telecare technology. Next slide, please. Within the next 14 minutes, I will try to explain major healthcare challenges, HCC, in the EU, nursing care in the EU, digitization to face healthcare challenges within the EU, Telecare, Addison care, and of course the development and deployment of Addison care. Next slide, please. As major challenges within the EU, we see digitization and demographic change are interrelated. We have a shortened hospital treatment. We have in fewer time, we have to treat much more patients than we were used, for instance, in the 90s. And you see here also, in the 90s, we had less than 50% of our patients suffering from chronic diseases. Now we are in 2020, and the forecast from the British Medical Journal in 18 years ago was absolutely correct. More than 70% of our patients in the EU and worldwide are suffering from chronic diseases. That's why we actively have to integrate our patients in their individual care process. Next slide, please. We see that nursing care can be studied in the States since more than 110 years. In the EU, since 1956, in the UK, in Belgium since 75, and the German-speaking countries in 82, or in Austria almost in 20 years ago. The facts are that health workforce imbalances and shortages are a major concern in the EU, and it will be worsened if we are not having the right challenges integrated within the next 4 or 5 years. There are almost 3 million nurses practicing in the EU, and the number of physicians and nurses have increased in general in our region. But we see also the baby boomer generation, the colleagues born in the 60s will be retired within the next 5-6 years, and we are facing a massive shortage within this time. Within the next 10 years are crucial, and we have to set the signals on green. This is absolutely our job within the next years. Next slide, please. The digitization means we have to optimize the healthcare at home, in the home setting, that our people are able to stay long time at home as possible. We have to support autonomous living in old age. Our clients, our patients, want to stay longer at home, and they want to live despite the fact that they are suffering chronic diseases. They want to stay in their home setting. They want to stay also when they are older, as long as possible with their beloved ones or in their home. We have to offer opportunities for social inclusion, security, and a good quality of life. quality of life is crucial, and we have to be able to increase the quality of life. There are some obstacles, of course. Are the technical solutions already available? And will patients and relatives, as well as healthcare professionals, accept and use the technology? These are the major questions we have to answer. Next slide, please. And you can press until the screen is full, please. We see the digitization, and we have many solutions already in the process. Electronic health records, health portals, online pharmacies, AL systems, telemedicine, and now we began since 4 or 5 years to improve also Telecare. And we see due to the pandemic that Telecare is urgently needed to integrate it in home care settings, not only for people suffering chronic diseases. This will be our target within the next years. But now, on the short notice, long COVID will be in our focus at least for the next 4 or 5 years. Next slide, please. We see that there are different scope of applications. There is a small basis of evidence for Telecare systems. Here we have an article for patients suffering for diabetes. Next click, we see here for patients suffering from Parkinson's disease. Or next one, we see a study which include also family caregivers. And next slide, here for patients suffering on pain and depression, the patients suffering as primary diagnosis with cancer. Next one, for patients suffering from dementia. And the last one, for solutions in mental health in Afghanistan. You see, we see the scope of applications widely spread. There is a small grade of evidence, and we try, of course, as scientists, to increase our body of knowledge. Next one. Telecare is an old concept, and it's also linked to culture and linked to the certain time. In the 60s, you see here nurses in Norfolk State Hospital and a brave cameraman. You see here a project in Canada almost 7 years ago. And Telecare 3.0 is Addison. Addison moves into EU houses, moves into US houses. And if we concentrate on the EU, you will learn within the next 7 minutes more details how we plan it, how we do it, and what it's all about if we're talking about Addison. Next one. Addison is a virtual caregiver, and you see that we have various experiences. The Addison experience will run after the first start. You can modify your system. Addison explains the system. Addison, the users have to verify themselves with login data, but very easy. It's a plug-and-play system which was designed for our clients, our patients. We have medicamente called drugs. It's a drug system where we try to decrease failures in medication management. Vital function. We want that our patients are taking their vitals, their pulse, their glucose, their blood pressure, their weight, and some other vitals, that we as nurses and or as physicians are up to date about the vital function of our patients. learning, we will integrate patient education systems, that we have a very close contact on the demands on our patient groups. Next slide. We see that we have measuring vitals, medication management, and tutorials. These, you see 3 checks, this is done. We will, next slides here, we will surveying patients for symptoms. We will integrate video consultations. We will integrate physical therapies protocols, because we want to decrease the risk of falls. We want to increase the muscle strength. If we, the lower trunk, the legs will be particularly in our focus. And we will guarantee a 24/7 virtual care. This is our aim. Next one, please. The benefits of Addison Care is an overall improvement of patient healthcare outcomes. And also you can measure it by the end of the day, of course, via health economic measures. We will have a more effective and affordable method of managing chronic conditions. Affordable is here important, because worldwide we are running out of budget, and we have to have an affordable patient care from the medical and the nursing point of view. And we want to improve the patient treatment adherence. The adherence not only to the medication, also to physiotherapeutical adherence, to the adherence if patients are suffering from mental illnesses. We want to be not only a daily advisor, a daily nurse, a daily physician. We want to be 24/7 with our patients. Next one, please. Our interaction with Addison is a natural language understanding and an automatic speech recognition. Next one, please. When we are calling Addison, Addison will respond, next one, naturally, and said, well, what's going on, Juergen? And Juergen answered, well, I'm feeling well today. And Addison said, well, we will measure now your vitals. We will check whether you have to take your drugs. We want to give you via structured patient education a better quality of life, and let's do it together. It means we have a machine personal interaction on a natural basis. Next slide, please. And we are having here a platform where also our patient can recognize, Addison Care can recognize what we have to actually do. Here, the patient has to take ibuprofen 200 milligrams at 10:15. And Addison will remind this patient on the left side. Next slide, please. Means our scope of application is in the patient's home, in the hospital, in nursing home, and we will give also a high value to practitioners, nurse practitioners and or GPs via call systems. We are structuring also the activities of daily living. We will increase the quality of life, and of course want to foster better adherence to nursing care. Next slide, please. The development and deployment of Addison Care, here you see on the left side the American version of a kitchen. And we discussed it within our European and American working groups in Europe. Next slide. It has to be different. Here on the right side, you have a very typical living room and kitchen for our patients in the German-speaking region. Next slide. The Telecare, the conclusions here, the Telecare, we have a good infrastructure for Telecare and the use of technologies. We have a chance to integrate patients into a care process on an ongoing basis. We adapted, and we have to adapt it even more as to linguistic and cultural needs of patients. Addison care will look different in Scandinavia or in the south of Europe. There are small adaptations necessary, but the cultural needs and the linguistic needs has to be taken in account. And we, as ECG Europe, are actually doing this. We have to raise professional care into a new system level. This we are actually planning, and this will be adapted within this year. Q4, we will go live to the market. We will implement all these 4 steps you're seeing here. Research, and I recognize the misspelling, the research-based testing of Addison care will increase also the scientific not only knowledge, but our scientific basis. And when we have an increase evidence, we will increase also our performance. This is absolutely interlinked. And we will develop more functions within the next years. We will partner with healthcare providers, insurances, and of course, the different governments. Next slide. Everything is not happen in a nutshell. Here you see Salzburg. Addison care will be within the next years the future of healthcare, and I strongly advise be part of the future. And I'm happy now to answer questions, and I put my question to the technicians. Are there any questions from the audience?
No, thank you so much, Juergen. It was a pleasure to meeting you again, and I believe we will see you again tomorrow.
Tomorrow from Stockholm.
Yep.
Talk
Thank you so much. Have a nice day.